guys, I'm Chris from Human Talk Training. In this video I'm going to show you how to get rid of trigger points in your psoas and how to massage your own psoas. If you don't know, the psoas is a muscle that connects into either side of your lumbar spine, so the lower part of your spine, and then it comes in through your pelvis, connects up with another muscle, your iliacus, and then it connects onto the inside of your leg bone, the top of your femur. So what this muscle does is it helps to lift your knee up, helps to flex your hip, helps pulling your leg forward. I've even read in other books that it acts more as a spine stabilizer and helps pull your femur into the joint. But that doesn't really matter. But anyway, if this muscle gets tight, which most people it is, if you spend a lot of time sitting, it can get tight. If you have trigger points in this muscle, which just means parts of the muscle are screwed up, it can cause a lot of back pain. Like when I had back problems, this was one of the main sources of my pain. It can cause a lot of oblique pain. It can even refer pain into the groin area and at the front of your hip. So stretching it regularly, like for me, I need to stretch it a few times a day, will help prevent all this from happening. But if you do have trigger points, you need to get in there and actually massage them out before stretching to get good results. Okay, so first thing you got to do is find the muscle. As I said, it runs down the side of your lumbar spine. It'll feel like a kind of a sausage running down the side of your lumbar spine and into your pelvis. So to find the muscle, you want to come onto your back like this. Now, I've seen people going straight in like this. I found myself I couldn't get the trigger points like that. So what you do is bring your feet up like this, and then drop your knees to the side. And this is rotating your spine, and it exposes more of the muscles. It's dropping your intestines out of the way so you can get in at the muscle. Now we've got to go in through our abdominals. Now I'm going in at about belly button level. Now if you lift your chest up, it'll turn on your rectus abdominis, six-pack muscle. You don't want to be going through that, so you want to come to the outside of that on your obliques. Okay, then get back down. So you want to really relax your stomach so you can get in. Now I use both of my fingers and I come in like this. You can use tools and stuff, but I think for this you really need your fingers to really feel where you are. Now, so belly button level, coming to the outside of my rectus abdominis, and I'm basically coming straight down in towards my spine, so on to the right of my spine. Okay. Now once you're in there, just to make sure you're on the muscle, if you do have trigger points there, you'll know you're on it because it'll be extremely painful. When I first done this, I only had pain on the right side. When I'd go into the left side, I couldn't really feel anything. The muscle was really soft. On the right side, my psoas was rock hard. Okay, so just to make sure you're on it, when you come in at about belly button level, keep one hand on it and then get your other hand and press your knee against it, and you'll feel something kind of jumping up. Okay, that's that muscle. Now, basically with both fingers, you want to apply pressure, and then from your belly button, you want to move down along the side of your spine, along your psoas muscle, and basically you're moving up and down, looking for really sore, painful spots. And like I said, if you have trigger points here, it can be excruciatingly painful. But don't get upset when you find those sore spots, because they're what's causing you pain. Like obviously, there's a lot of things that can cause back pain, but if you have trigger points in this muscle, once you find it, you basically want to apply as much pressure as you can, so it's not too painful. And then basically, like the muscle's running long ways down this, I'll kind of work across ways like this, just going across the fibres. Okay, just massaging backwards and forwards, and basically trying to soften up the muscle and get rid of those trigger points. And just stretching the muscle, if you've got trigger points in there, won't get rid of the trigger points. You need to do this first, and then stretching regularly, like a few times a day, stretching the muscle. I need to stretch it a few times a day at least to keep length in it. As I was saying, if you sit a lot, this muscle can get really tight, so you need to do this stuff to release it. Now, there is one other trigger point that you can get in it. After doing this for about a month, I totally eliminated oblique and back pain there that I was getting. The pain kind of moved down to the front of my hip, and I ended up going back to books and looking, and I found you can actually get a trigger point at the insertion part of your psoas. So the part of your psoas where it hooks to the inside of your femur, your leg bone. Now, you can just go in with your thumb. I've found like it's hard work pressing in with your thumb, and really you need to get more pressure on it. So the way I've done it is, just get a spot so you can see. Laying on my back, I use a tool like this. You could use any kind of stick as long as it's not sharp on the ends. This is just the perfect length. When I'm laying like this, if you lift your leg up like this, you'll feel one big dominant muscle here in the middle jump up. Basically, you want to come under that. Okay, so that big dominant muscle, you want to come under that, and I'm working sort of within an inch of my pelvis. Okay, so I'm working really high up. That's where the muscle connects in. So find that dominant muscle, and then I'll put this just under it. So I'm kind of coming in at an angle like this, and then I'll put this under my calf of my other leg. So I'm using my hand to kind of guide it, and then just moving around and looking for the sore spot. So I'm applying the pressure with my calf, pushing down on the club, and kind of using my hands to jiggle the stick around. And after releasing this trigger point, without even doing a stretch, I had far better hip extension, which was pretty crazy. When I've been doing heaps of stretches and I didn't even stretch it and just hit the trigger point and the insertion point, and I had far better hip extension just from that. So yeah, if you do have trigger points in your psoas, I pretty much got instant relief every time I did this. Okay, and the more I did it, the less frequently I had the muscle would spasm and cause pain. And now I have no issues with it. Every now and then it might get a little bit tight, and I'll go in there and massage it and release it. But the more you practice this stuff, and after you've done this a few times, you just go bang straight in, and you'll know exactly where it is. So yeah, do this, and make sure you stretch the muscle heaps.